Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound guided chemodenervation of the hip adductor muscles. So, when I say the hip adductor muscles, we're going to look at the adductor longus, the adductor magnus, and the adductor brevis today and how to identify them. Like all my videos, the muscles that you see today are of myself, which have normal echotexture. Individuals with spasticity, we often see increased hyperechogenicity to the muscles. So when we start, we're going to look first at the adductor longus and the adductor brevis. So what you can do is take your probe, your ultrasound probe, and put it in short axis over the medial thigh. So generally 3 to 4 finger breadths from the pubic bone. Now, the most superficial of the 3 hip adductor muscles is the adductor longus, and then deep to that will be the adductor brevis, and then deep to that will be the adductor magnus. So the way you can remember it is as Alabama, AL for adductor longus, then deep to that AB for adductor brevis, and then deep to that AMA for the adductor magnus. And ensure you're medial to the femoral blood vessels. And we're going to use this on ultrasound to help identify the muscles by first identifying the femoral blood vessels at the inguinal ligament and then moving medially. So we're going to start. So I've just paused. I have the ultrasound in short axis and I have it sort of in the plane of the inguinal ligament, and I've identified the femoral blood vessels. So there we have it. Now what I'm going to shortly do is I'm going to move that probe now more medially. The first muscle that you're going to see, which I'm going to identify, is the pectineus. And then medial to that, we're going to find those hip adductor muscles. So here we go. I'm moving the probe, and there we're going to pause right there. So there's my pectineus muscle. So again, I've gone medial to the blood vessels. Now I'm going to go even more medial. And when I do that, the next set of muscles I'm going to visualize are the adductors. So here we go. So I'm moving that probe, again, now medially. And we're going to pause right here. So if you can imagine, there's this fascial plane that I've identified here in white lines that are separating the superficial adductor longus from the adductor brevis to the very deep adductor magnus. So at this level, which again, you could start 3 to 4 finger breadths below the pubic bone, you'll have these 3 muscles, and you could inject the adductor longus and then go deep and get the adductor brevis. And so that's how you can do this. And this is just, again, looking at, you can see the fascial plane there in those videos. So when it comes to dosing for the adductor longus and brevis, there's no recommended dose per the product monographs, whether we're looking at Botox or Dysport or Xeomin, but they're large muscles, so bear that in mind when you're dosing. So now we're going to move on to the adductor magnus. So proximally, as I've shown, we know it's deep to the adductor longus, AL, and the adductor brevis, AB. Now, I prefer to inject about at least a third to halfway down the medial thigh because now it's more superficial. It's easier to access. At this level, it's deep to the gracilis muscle, and we're going to use this relationship to identify the muscle. So I've got the probe in short axis. I'm going to shortly here tell you what we're looking at. So we're going to pause right here. So I'm about a third, almost halfway down the medial thigh. The first muscle you see is the overlying gracilis, and then deep to that is the adductor magnus. So this is where you could inject the adductor magnus. You might go a little bit more distally. The gracilis might start to become thinner. But how do you get to this view, and how do you make sure these are the muscles you're looking at? So what I'm going to show you now is I'm going to take the probe, which is again in the medial thigh, and I'm going to translate more laterally so that now we're sort of approaching the anterior thigh. And we have this muscle, the sartorius, that we know runs over the femoral blood vessels. I've talked about this in a previous ultrasound series. So if you can identify the sartorius, you know that the gracilis, if you bring that probe at the same level more medially, you'll then identify the gracilis, which will help identify the adductor magnus. So here we are. And then if I bring that probe now over medially, boom. There's our overlying gracilis. Deep to it is the adductor magnus that we want to target. And again, we might move the probe a little bit more distally at this level so that the gracilis tapers. And then the adductor magnus, we can appreciate there some of the contour of the semimembranosus, one of the hamstring muscles that we want to avoid. But again, I've shown you this just so that you're aware of the surrounding muscles. You go too far posteriorly, you'll get the hamstring muscles. you go too far laterally so that you're more anterior, you might get the sartorius. And then if you're too superficial, you may get the gracilis. So when it comes to the adductor magnus, there's no recommended dose per the product monographs, just like the adductor longus and brevis, but just like those two muscles, and particularly with the magnus, it's large, so bear that in mind with your dosing. So that concludes today's video. I'm the neuromuscular mechanic, and I hope you found today's video handy. Take care and thank you.